And good afternoon, everyone. Thank you for being with us today in this community chat of January 20th. Today, we're going to be talking about different programs that are coming out of the DOH, Department of Health Office of the Diversity and Inclusion. And today we have two great guest speakers. We have Matt Knudsen,
yep.
Good. Knudsen and Sarah Wallner with us, who are going to be talking about the different programs that are coming out of this office, which it's a lot. And I'm sure that is going to be very helpful for all of us to know all of the initiatives that they're forging. So first of all, thank you so much for being here, for you, my guest speakers, and also to our attendees. And I'm going to explain a little bit of how this works. So it's more of a Q&A, and the attendees are welcome to use either the chat or the Q&A features here in Zoom to ask questions to our experts and I'm going to be reading these questions to you as well. So I have my own questions because I like to ask a lot of questions, but at the same time, we're going to be answering questions from our attendees, okay? And then I'm just going to start with asking you, Matt and Sarah, to introduce yourselves. Tell us a little bit about what you do and how you got into working with diversity and inclusion.
Yeah, so I'm Matt Knudsen. I'm the Chief Diversity Officer at the New York State Office of Mental Health. I lead all of the initiatives that are related to health equity and special populations, reducing disparities, which basically means that we work on ensuring that every part of New York's population, people of color, people with limited English proficiency, people in the LGBTQ community, Native Americans, immigrants, everybody who are the special population groups, I obviously left many out, are able to receive access to high quality mental health services. And we know that that's a challenge for a number of different reasons, primarily because most people, your level of risk for an illness and then your chance of getting treatment is affected by the social determinants of mental health. That's the neighborhood you live in, that's the amount of money you have, that's whether or not you face discrimination, that's the food that you have, all of that kind of compounds. So there's a number of different reasons why we need to pay special attention to certain parts of our population to reduce disparities that we know actually exist in access and quality. So we do that for all the licensed funded programs out in the community, but then we also at our office, we operate the internal OMH workforce, which is 14,000 people across at least 50 work sites across the state. We do the internal workforce diversity and then inclusion strategies there as well.
Thank you, Matt. Sarah.
Good afternoon, everyone. I'm Sarah Wallner. I work in the Office of Diversity and Inclusion as well under Matt, and he did a nice job of painting a clear picture of all of the different activities that we do around equity and the reduction of disparities. So I won't repeat that. My role here at OMH is an advocacy specialist, and I'm really responsible for all of our offices, external and internal facing content creation, presentations, and just all that we do and push out to the community, informing them of the work that we're doing and all the efforts we're taking to reduce disparities. So I'm just joining Matt here today as a second person, and I'm happy to be here.
Thank you both. So give me a little bit of background about this office. Is this like a new program? How long has it been in existence? Where did the idea come from?
So the Office of Diversity and Inclusion has been around for many years. A number of commissioners ago, it got started up, just as there was more of a recognition that we needed to make sure that we were doing right by special populations. It was really driven by the work of external stakeholders and advocates. There's a group that we still work with now that's a part of the work that we do, is the Statewide Multicultural Advisory Committee, which is a group of stakeholders, consumers, family members, experts, researchers that really represent the main priority populations in the state. And they wanted to ensure that the agency was adequately paying attention to the special population work, including language access. And they reached out to the agency and pursued having an office that was staffed. And at that time, in the beginning, it was the committee, which was external stakeholders, and like one staff person, which was called the SMAC secretary. Since then, it's now grown and expanded to about 5 staff. The level of seniority of the positions has been expanded as well in the office. Even in the near future is going to be adding more staff people. So, and that's one of the necessary components of it, having an equity strategy in any size organization, is that it needs to be adequately resourced and adequately staffed if you're going to be able to push the work forward.
And I think, Matt, that a lot of us care to help lower those gaps, you know, in diversity and all of that. So either personally, professionally, or both for some of us. So how did you join this task force that you are talking about? I think a lot of us didn't even know that that existed.
Yeah, one way to find out a lot about the different things that we do is by joining our listserv. And Sarah, if you could put your email address in the chat, and then you could let me know who would be interested, because that's where we send out all the information, news, updates. The body, the SMAC, is somewhat, the Statewide Multicultural Advisory Committee is somewhat autonomous, in which they do an application process and then they, you know, do nominations and such that pick people. But there's a whole bunch of different ways that people can be involved. We do webinars, we have sessions, a lot of sessions like this. A lot of it's really focused on capacity building. You know, we want to help individuals in their own organizations be able to improve, you know, their equity work. But then, like you said, which is really important, we also, you know, want to give people personally the opportunity to reduce biases that they have and kind of improve their own personal, because you're right on point with that. It's kind of two separate things. It's the structural work that we need to be doing here, and then it's the internal personal work that a lot of people are interested in doing. So we do both, and we can really help people kind of see through some of those different pieces. And we'll send out as well information about the Harvard Implicit Bias Test to you, which is something that is a good tool that we have had our whole staff at OMH, you know, partake in. And it really gives you a chance to see personal biases that you might have, as well as we'll give you information about what people can personally do to alleviate biases that exist if they have them.
Mm-hmm. And Matt, can you give us a little bit of background on those biases for specifically for Rockland County, since we are in Rockland County, but maybe you can also talk about the state, right? Yeah,
so biases can come from anything, you know, and it doesn't necessarily have to be somebody that specifically works in the mental health field, obviously, right? Biases are internal, they're in us, they're unconscious. We don't usually think about them. They're based on, you know, what we think about people who are different races than us. They're based on what we think about people that have different characteristics, women in the workplace, obesity, what we think about new Americans and immigrants. All of that really is wired into us. You know, what we think when we see an individual, we have not that much control over, right? What we do have control over, though, and we can reprogram the way that we think and then obviously act. We do have control over our reactions and what our thoughts are about these specific things. But some examples, right? I'll just give you a couple examples, a little bit abstract, but how they play out, right? They do this research where they give a whole bunch of pictures of individuals, right? 13-year-old boys, and they give everybody these pictures. And, you know, they'll give 1,000 and they want people to guess the age of the individual in the picture. Well, children of color, if you're a Black child, people are more likely to think that the child is actually older than they really are, not 13. Another is that when they ask people to say whether or not you think somebody is strong, how strong, rate this individual, we're going to give you a picture, rate 1 to 5 how strong and physically strong they are. People always usually pick darker people to be stronger than lighter people. There's a whole bunch of different things that compound. Some of it's also just the way that we get information and the way that we kind of think about stereotypes, right? We can reprogram ourselves around stereotypes as well. Some things are accurate, some things are not, you know, and I think that, so for example, one of the strategies that you can use, you can pick out maybe a stereotype that you personally think, and you can think about in a very mindful way, you know, examples in your life about how these are not the case. And I'll give you an example, right? I'm a Black male, obviously. There's a stereotype that Black people are loud. right? We're loud. It's a stereotype.
You're right, absolutely.
Well known, we're loud, right? I am loud though. But what I did, because I knew that this was a strategy, I said to myself, I want to sit and I want to think about all of these people that I work with who are Black, African American as well, and to really consciously think about them. And I just tallied in my head all of these people that I come in contact with on a regular basis. And don't you know, 201, they were all quiet. They were quiet. They were Black people and they were quiet. Half of them I have been in meetings with, maybe I didn't hear one word from. A couple were like, maybe I talked to, but like they just weren't loud. So it's just interesting, like that's how we can reprogram our thinking around. And that's a very mundane, safe example. There's obviously more around criminality and a bunch of other things that also exist that are important for us to look at.
Now, Matt, is that something we're born with, or is that something that is instilled in us from childhood, let's say from our parents? It's a cultural thing. Where do all these bias come from?
It's cultural things that we pick up over time. You know, it's proven that like a lot of these things are learned, and we pick it up from. That's why it's really hard. Any of this work that we do about equity or diversity or, you know, special populations is very challenging because it really asks for people to a lot of times challenge their own internal belief systems around things. So for example, like this is a very simple one, you know, is there's generally the perception by some people, right? Like they think about people in poverty, and there's kind of this school of thought that like people living in poverty could easily get out of poverty, right? And you'll hear people say things like that. Well, if they worked harder, or if they, they worked harder, pulled themselves up by the bootstraps, whatever you want to say, they'd be able to do this just like anybody else, right? But that's like that's obviously inaccurate. But it's ideas and thoughts like that get in people's mind, and they're reinforced by messaging that we hear. I mean, social media plays a big role in it, because the thing about social media and the media in general now is that like we mostly gravitate towards ideas and thoughts that reinforce ideas that we already have. So if you believe in some of these different things, you're going to really engage in a lot more discussions with people and news sites and everything that are going to like reinforce, and it kind of snowballs until you have these really deep set beliefs. Somebody said getting out of poverty is definitely not an easy feat. No, it's extremely, extremely, extremely hard. But it's just like an interesting example, because another one that you'll hear is people will say, this is like, you'll see a meme or you'll hear people say, you'd be better off if you were on benefits. Like, that's just not, that's just completely inaccurate, but it's like those ideas that get in people's minds that ultimately, but we can retrain our thinking about them. And I think a lot of it is our perception and our agency and kind of our value is to call people in and have these discussions and educate in a loving, kind, compassionate way. Because it's also important to remember that, a lot of the ways that people think about things is protective to them for certain reasons, right? So meaning like there's a certain reason that people think this way. There's a certain reason that their values might have them thinking that like a certain thing. Like, for example, I'm gonna give this example, is that the reality is that research has shown that the majority of white people in diversity trainings think that something is being taken away from them, right? And that's like a true fact, right? They think that like diversity efforts mean that they're going to actually have less, right? And they don't even know it. They probably consciously don't even think that that's what the case is, right? They're going to have less opportunity. They're going to have less money. They're going to have less, whatever it is, less money for their kids, whatever it is. So I think attacking that idea from saying you're a bad person is not the way to go, but to like really relating and saying that like making sure that our needs are met is something everybody cares about, and finding common ground and realizing and kind of informing people just because we're trying to give opportunity to other people doesn't mean you're going to lose out in any way.
Mhm. Yeah, that's definitely interesting. And at some point, you also mentioned there is a test that we can take to help us identify how biased we are.
Yeah, we could put that right in the chat. So I mean,
Oh, that would be great.
Yeah,
I
Harvard
know Jill
implicit
said
bias
she wants to
test.
take it. I want to take it. That sounds,
Yeah, it's really interesting. So it's unconscious bias. And it's really funny. So I, for years, have been suggesting people take it. It's fairly well known, but a lot of my friends that are Caucasian or that good close friends of mine, it's interesting. They will say right away, like, I think the test is faulty, or I think it's broken. Because you have to remember it's unconscious. And you also have to remember that a lot of times you might be a part of, you could be a woman that leans against women in the workplace, right? You can have, and why that is that your internal bias, right, can be counter to what your expressed feelings are on something. And what I mean again is that, so it's very simple. Like, you could be a African-American person and you could have bias against African-Americans. You know, that's still something that, you know, that's like a very real thing that happens. Like in a lot of those like tests that they do with police officers and police shootings, and you know, what they'll find is that even police officers who are Black have some level of bias that leads them to think that there's a higher level of risk and dangerousness with Black individuals.
Right. And I see, Sarah, thank you for sharing the link. That's great, because I know a few of us will be taking it. And, you know, it's unconscious, right? We don't know what bias we have. We think that we don't have any, and then we find
So
out.
you're not going to know. You're going to be surprised. If you think that you don't, you're going to be surprised, because that's the point of it. It's unconscious in you. And It's a method of pulling out, like, they repeat the same questions, but worded a little bit differently, and they keep going and going and going and going. And eventually it gets to the end.
Yeah, but what I know is that the first step to start to change is to be conscious that we are and we have bias. So I think this test is great, because it's going to help a lot of us know that no matter what, or how open we think we are, we might still have some bias to work on. So that's great. Thank you for sharing that. Now, let's talk about specific programs that you have coming out of your office. I don't know if you call it programs or initiatives. I know there are also grants that you offer, and it's not necessarily for organizations, right? It could be a big organization, a smaller. So let's talk about some of those programs. So what about human trafficking, for example? I know that you guys do something with human trafficking.
Yeah, we sent out we work closely with the Department of State's Office of New Americans, and they recently, we passed along for them an opportunity for some training and a webinar specifically about the impact of human trafficking on new Americans, which definitely is obviously a population that, you know, suffers a great deal because of, their population that can be taken advantage of because they're a marginalized population. So our interaction with the Office of New Americans is really more expanded than that. We are trying to work to improve the level of knowledge and interaction in the mental health community to be able to meet the needs of Afghan refugees. That's been some other work that we've worked on, because obviously there's been an influx of Afghan refugees in New York, a lot of them with, you know, additional cultural barriers, obviously having high rates of trauma, obviously probably suffering rates of discrimination in our country as well. That's been some of the other work that we've done. But then more broadly, just the immigrant population in general is one of the populations that has higher rates of need. Language barriers is obviously high there as well. Trauma is usually more prevalent. So it's a population that, as the mental health system progresses, we need to make sure that we're adequately, you know, addressing their needs.
Mm-hmm. That's great. How do you get part of this program? Like, for example, for us as a hospital, is there a role that we can play?
Yeah, I think that the best thing that we can do is we could set you up with, on that specifically, is we could loop you into the different pieces of information we've been sending out about how to better serve immigrants, and we have a tip sheet, and we have some different things there. On that, it's, really having the organizations do an assessment on, a community assessment on, is there any parts of the community currently not being served? One way that you can do that typically, so it might not be your organization serving people, but they might not be getting served at all. I think that it takes looking at school district registration demographics, it's looking at census data, and then matching it up with who is served in the mental health system locally to see if there's any gaps of pockets of the population that are not being served.
Yes, excellent. Now, talk to me a little bit about the Office of New Americans.
Yeah, that's a part of the Department of State, so it's outside of the Office of Mental Health, but the Office of New Americans is the agency and the office that's tasked with programs, supports, and some of its funding that goes to organizations to be able to provide more direct personal advocacy to families and such that are new to the country, new to New York.
Mm-hmm.
And Sarah, can you put their website in the chat too? Because they have a whole bunch of programs.
I was actually just about to.
Some of it's legal representation, some of it's actually access to services.
It's important to know that they have a hotline as well, that if you click on the link I'm about to drop in the chat, they actually have a staffed hotline where they're able to connect new Americans to needed services and support. So we certainly want that to be shared broadly.
Okay, yeah, that's great. I mean, the more resources we can share, the better. So thank you for putting out there. And, I don't know if you're familiar with this, but we recently opened an LGBTQ wellness center here in Nyack. And now I'm hearing that you also have some programs that benefit the LGBTQ community. So do you want to tell us a little bit about that?
Yeah, so obviously that's a population that we're extremely concerned about. There's higher rates of suicide, higher risk of, psychological issues, partially because of the higher levels of discrimination, and not being accepted by family members, not being accepted by society, but also again, then it affects the social determinants. There's higher rates of unemployment, financial wealth building, all of that then, is affected by this population specifically. And there's unique needs when we're talking about younger people as well. So across the lifespan, there's different issues. So an older person in the LGBTQ community has different issues and different needs than somebody who might be younger. So it's a huge population that we pay attention to. And we fund a number of programs that specifically are mental health programs in the community that specifically focus as a target population, people in the LGBTQ community. Of note also is the Rainbow Heights Club in New York City and the LGBTQ Human Service Network. And Sarah, you could put them in the chat as well, which is an amazing group of professionals. So they do direct service, but they also have a network of programs that are, rainbow friendly in the services that they provide. And they, do a lot of training. And a big piece of training that they've been doing for us recently is for trans non-binary patients, which is extremely, extremely high. So that's, adequate use of pronouns, how to address, making sure that you're gendering somebody the right way, in documentation, all of those different things, and that you're just providing affirming care and access to care is important as well. So that's an important organization. And then most communities have a local pride organization that, we really suggest that mental health organizations are collaborate with and kind of have on speed dial for collaboration and making sure that their community is aware of the services that are available.
Do you know a little bit about their trainings? Are they virtual? Is it easy to register? Is it for individuals? Is it for organizations?
So them right now, they're looking to do more upstate. It's mostly been in the New York City area. We're trying to get some a little bit additional funding to have it open up. If an organization or a locality or a county wants to contract with them directly, they can. Because I will tell you, it's an amazing, amazing training. It is the premier training on if you want to know how to serve trans non-binary individuals adequately in your system. That's the organization that you need to talk to. So we're trying to expand it more, and we'll have them be a part of our webinar series. Part of the issue is that it's definitely meant to be a little bit of a smaller group. So it's not meant to be like 1,000 people in a webinar. These conversations, discussions for this specific topic is a lot better if it's done, 20, 25 people, 30 people max. But yeah, you can contact Parker is the name of the individual that we mainly contact with there, but Christian Huygen is the executive director.
Mm-hmm. Oh yeah, definitely. And we're getting a comment from Caitlin saying LGBTQIA, definitely younger people and people who have yet to change their names if they want, are mistreated, definitely misunderstood. So many ways they are misunderstood. And Marielle is saying Rockland Pride Center in Nyack also provides great trainings to our community, which is true. Yeah, we usually get our trainings from Rockland Pride, and kudos to them because they're our huge partners in our LGBTQ Wellness Center. Okay, telehealth. You're also involved with telehealth somehow.
Well, we don't specifically, I mean, the agency overall, when COVID came, a lot of the regulations around the availability of telehealth was relaxed because obviously we needed to have our providers, we needed to give them the ability to provide telehealth, which for a period of time was the primary way that people were then able to access services as things were, generally shut down. And to a certain extent, that's going to continue. It's not the be all end all. For certain people, it works better. There's certain parts of the population, though, that we still have more concerns about around telehealth, such as if you live in a rural part of the state that has broadband or cell issues, that's a huge barrier. If you're an older individual or just somebody who doesn't really understand technology as well, there's been some barriers that are involving, somebody's ability to even use the technology to do telehealth. And then people that are limited English proficient or deaf ASL, sometimes there's an additional complication using the technology, especially if the provider is not aware on how you should be using those additional pieces. So for the most part, it definitely is welcome. It doesn't replace face-to-face services by any means, but it is a tool that some people can use.
Mm-hmm. Now let's get into COVID a little bit, because COVID is the new era. I don't know, we're all living with it. It's been 2 years and we're still in here. So, and I know that you guys have done a lot around COVID and all the mental health services needed, for many different circumstances. So let's switch gears here a little bit and let's talk about that. So how has COVID impacted the work that you do? And how do you feel that you are providing support to our communities around COVID?
It affected us greatly, affected everybody greatly. Just to kind of pull the camera back a little bit, I think that, for a lot of different reasons, COVID brought a higher level of stress and anxiety to individuals that were not previously, experiencing that level of stress and anxiety. So what I mean by that is we had people who were already receiving mental health services, maybe less than acute. And then we had a big portion of our population who maybe had never received mental health services. Now, because of, issues with maybe losing their employment or unstable employment, the uncertainty, having to now be a teacher for your children, all of these different things, trying to, worrying about not getting sick, worrying about keeping your family members safe, all of these different things. And, it's historically known, obviously, that change is a huge driver of stress in people getting out of your routines, people getting out of the normal way that you live your life. That obviously is a huge, huge driver of stress. So all of a sudden we went from, the needs in mental health exploded. In most parts of the state, there was a threefold increase in acute need. So that means hospitals that were traditionally getting 10 individuals a day, we're now getting 30. That's just a random number, but, and that was across the state, and it especially affected young people. It affected everybody across the lifespan for a lot of different reasons. And now the intersect with our work was that it disproportionately affected communities of color. You know, the death rates and infection rates of COVID-19 have been very targeted in specific communities. In fact, 73% of the deaths in New York State have been people of color. So for our work, we in the Office of Diversity and Inclusion, it became very important for us to make sure that any of the supports, mental health supports, there's Project Hope, there was money from the federal government to be able to, you know, run that amazing program that has a crisis line and crisis counselors for individuals statewide, that we wanted to make sure, and we did a great job of making sure that that was able to be in the communities hardest hit. But then also the vaccine education and that type of work was done in a way that would really drill down deep into the communities that are sometimes hard to reach because of language access issues, greater mistrust of government, mistrust of the medical establishment. So it's had a huge impact. But I think that the good news is, you know, we seem to be at a better place. You know, we have numbers that are better than they were last year at this point. And that's with more things open. So we have basketball games happening. We have football stadiums full. We're going to the mall. We're going to restaurants. We're going to school. We're doing all of these different things. So with all of that happening and open, the fact that we have numbers that are somewhat comparable to last year when everything was closed means that we are moving back to a level of normalcy. And I think that everybody should be hopeful and, you know, proud of the work that we've done, both as a system, but then, you know, as individuals as well.
Yeah. And do you offer different programs to help with mental health services?
Yeah, so we have Project Hope, which is what I talked about a minute ago. And then, you know, we have a lot of different in our community networks. So if somebody had a question about what, you know, more specifically in a specific region, we could provide them with connections to connect with mental health services in those specific places, or about maybe a certain population that they were more interested in getting the information from.
Mm-hmm.
The other is that, you know, it's had a big effect on schools. We got a lot of money from the federal government to expand capacity and to also support the mental health workforce, which is for years and years been inadequately funded. And now the demand is higher. So we're happy that we received that funding, and we're happy that that is allowing, you know, some people to obviously enter the mental health workforce, but some additional people to stay in the mental health workforce, because we've always been in competition with other sectors. You know, we lose people who are just like, it's not, you know, it's not enough funding for me to stay here working as a social worker in mental health when I could go to, you know, another sector like retail and make maybe even more money.
Yeah, and I feel you guys have some grants available to be able for organizations to hire mental health providers. Is that correct?
Yeah, so we can put, actually, Sarah, you just put Project Hope in there. And then there's the link to the accessing the federal funds. We could put that in there, and it really talks about all the different ways that you go about doing that.
Sarah, do you know all these links by memory? My God, you're
the
so
same one.
Right?
Yeah, she knows. That's why I told you we needed her here.
Yeah, that's great. That's great. I feel like, my God,
I'll be digging around. It'll take me an hour just to find it.
No, she it looks like she knows everything. She can just type them and that's it. It's great. Yeah, it's good to hear about those grants, because, you know, there might be a lot of organizations out there. But now, even if you have the money to hire some mental health providers, it's so hard to find mental health providers. And you being from the Diversity and Inclusion Office, you know that finding providers that are bilingual, either in Spanish, French, Creole, it's hard. So is there any way how you are addressing that issue of lack of providers?
Yeah, so we obviously have a whole bunch of work that we do on trying to diversify the mental health workforce, right? And a lot of it is strategies that we give to organizations, such as even our own, about things that we need to be doing to pull in more diverse candidates into the workforce. It's complicated for a lot of reasons, one of which is that the mental health system has, you know, educational requirements that are somewhat large, you know, psychology, psychiatry, social work, You know, you have to be a master's level individual, and we have achievement gaps in when it comes to people that are, you know, people that are marginalized or people that are minorities. So that's one of the reasons that we end up seeing it. The other is some cultural reasons why, you know, there's some cultural beliefs that, you know, make going into the human service sector not something that people would do. We also, I think that, you know, economics plays a role. You know, it's not really it's not really, you know, the mental health workforce and human services isn't like viewed by people as being like the golden ticket, you know. People aren't going to get rich usually in their mind being a social worker. So if you grew up poor and you grew up marginalized, you're not going to probably sign up for what you might in your mind think is not going to be that lucrative of a job. So that's the other thing that's a challenge. But we are interested in continuing to pursue pipeline programs like one we just are starting with SUNY and CUNY, where we are providing up to $10,000 for each student who is bilingual, multilingual, as well as individuals who are from diverse backgrounds, for them to go in, stay, and then complete training in any of the mental health fields. So that's psychiatry, that's psychology, that's licensed mental health counselor, that's social worker. So that's a big deal. And the amount of money that we're using right now, it's going to be about 600 individuals new that are multilingual or diverse that will come into the mental health system in New York State that would have previously not done that. So that's huge, but that's a project that we have to make sure continues past this, because that's the only way. It's economic incentives. That's the only way that we can really ensure that that we're adequately providing diversity to the field. And because the other thing is that there's also a completion gap when it comes to people start school and then they don't finish. So this money is actually allowed to be used for transportation, childcare, paid internships, even childcare. Yeah. So that's huge. These are some of the barriers, the real life barriers that somebody who might be a Latino or might be a Black person who's interested in going on being a social worker, who wants to finish their degree, anybody. And a lot of the reasons, just the traditional barriers that we have.
Yeah, been there, done that, Matt. Yeah. I wish they had this program when I was in this.
Well, and then the idea, is that, they will then go back, and when they're done with their school, they'll have to work for a certain period of time specifically and stay working in the system in New York State. But it definitely is going to be a help to the individuals that they serve. And on the language access side, it's going to be huge, because even when we provide interpreters and even when we do that, it's not as good as when we actually have the provider with the language capability. That's the thing, is that we need to know as a system, we get a B off the bat, right? We get a B if we provide interpretation the right way. You know what I mean? If we actually have psychiatrists, psychologists, social workers who speak Spanish or Chinese or any of the languages we're talking about, that's like a game there, and that's the goal that we have.
Yeah, and not only that, Matt, but at least in my profession, I'm a dietitian. It's knowing the culture as well. It's the knowledge of the culture, because sometimes you can translate and speak the right words, but if you're not familiar with the culture of the person, it creates a barrier, and especially when we're talking about healthcare.
But it's also about trust.
Absolutely.
So it's also about, there's a higher level of credibility and trust when you have an individual that you can relate to for any number of reasons. Obviously, race and ethnicity and language is like a very important piece. But everybody knows from relationships that we have, right? When you're on vacation and you talk to somebody at the airport in the other country who's from your hometown, you're always like, whoa, you're from there, I'm from there. It's like that connection that you have from people is big for any number of reasons, but obviously race, ethnicity, and those things are those are strong, strong bonds. We know that, I always let people know, it's kind of a weird thing to say, but if you're a Black individual, right, and especially if I'm in an area that doesn't have a lot of other Black individuals in it, right, maybe I'm somewhere that's mostly Caucasian, like when you're in the grocery store and such, and you see another Black person, there's this nod that we give each other. There's this connection there that we have. There's this affinity that happens, and that's just not us. It's everybody, But I think that culturally and race, it's like definitely important.
And now Caitlin is actually bringing up a good point in the chat. She says she's a person low income with disabilities, but she's Caucasian and she only speaks Spanish. But I think that this brings a good point, because if she's a person with disabilities, that's another type of culture and that's another minority, right? So are there any grants available for people with disabilities, even though they're Caucasian, they only speak Spanish?
Yeah, I mean, that's big as well. I mean, we definitely, there definitely is support and things available and we're very interested in people with lived experience with disabilities being able to support other people. We have a whole office and group that's focused on, our Office of Consumer Affairs that's focused on expanding the use of peer services across the state. And that's another important thing. I think I mentioned it before I got on this, before everybody came on, but I'm a person in recovery myself. And I got a lot of support and continue to get a lot of support from people that walk the same walk as me. So it's definitely something that's important.
Yeah, and I think that it's interesting how we're moving into life experience as with the same or even more value than professional experience, right? Because when you've lived something yourself, you definitely can become a peer educator, a peer professional. Like it's great. So Sarah, do we have any links for those grants? I don't know, for the college grants that you were mentioning? And
so we don't, I'm actually the lead on that SUNY CUNY work that Matt was just speaking about previously. And as of right now, it's not, we don't have any public like marketing and promotional activities around that, but that's definitely on our docket to do. And we can certainly make sure we circulate more once it becomes somewhat finalized. We're in kind of the contract legal back and forth right now, but we definitely want to promote that and encourage anybody to participate in that program if they should so be interested once it becomes live and launches hopefully later this quarter.
So
stay tuned.
Yeah,
so you guys got
and that's our listserv too. That's also, I want to bring up the importance of joining our listserv for folks who might be interested, because we certainly share a lot of different opportunities via that, and that will be a huge channel that we use to promote that program and that funding as well.
You heard it here first.
Yeah, that's great.
Hey, brand new. You guys are
there you go. The beauty of the community chats.
Yeah.
So thank you for sharing that. And yes, I agree, Sarah. Please thank you for highlighting the importance of sharing these, like to be part of the listserv. So to all of our attendees, if you're not in the listserv, email Sarah. Make sure you get these hot off the press news all the time. I know I get like 3 emails from Matt a week. I'm like, I need to have him in my community chats because so much is coming out of that office. So it's great having you. We don't have a lot of time left. We have like 10 minutes left. Again, it's so much that you guys do. I know that you have some events also, like you have some events for MLK. But it's not the only events that you do. You do a lot of promotion. So why don't we talk about that?
Yeah, so it's important for us to just make sure that we're really promoting a lot of the different cultural events that are taking place locally and across the state. It's actually important. It's very important. The recognition, the understanding about these events. And I've always been surprised. So we send out these events too, and information about it to our 14,000 employees across the agency. And you always get so much back from people in the value of them just feeling heard, them just saying or seeing, them just realizing that the leadership in the organization has an appreciation for the differences that they have, has an appreciation for the culture that they come from is very important. And because of COVID, a lot of these events have been a little bit more virtual, and we're hoping and looking forward to in the next year to getting back to the face-to-face events. But we'll give people a lot of information about that. And Sarah, I also want them to have the link to our website where we have all the recordings of trainings and all of that type of stuff available, because we have a whole webinar series that we do on fusing topics of equity, diversity, inclusion into the programming and the work that you actually do. And if you have that, then, you'll be able to see the recordings that we have.
Yeah, that's great. I really think that it's so much that you guys are doing. I'm really thankful because being part of the minorities, working with minorities, and again, for all of us, it's not only professional, but it's personal as well, that we want to help our communities. So thank you for everything that you're doing out of your office. Thank you, Sarah, for writing all these links. I'm sure people are like eager to be part of the list.
People are signing up for the listserv right now. I'm getting the announcement.
Exactly. That's great. That's great. See, you need to come more often. We need to do this more often. So really thank you. And I don't know if you have any last thoughts, or maybe you, Sarah, you want to highlight something that we haven't spoke about.
I would just say as a personal message to people, just, I want people to focus on their personal wellness. I want people to focus on being kind in the community. Be kind to yourself, be kind to others. I think that kindness is a public policy kind of theme that we talk about a little bit less, but I'm pushing it. And I think that, if we do that, we can really make sure that we're working personally and then professionally in a way that will help out, people in the ways that they need it the most. And I want people to definitely take care of your personal wellness. It's, been a challenge because of all the changes and different things that are happening. We can send you out something specifically right now. We'll share, but there's different tools and things that people can use and look at that are very simple, because we encourage you to just do a couple different things that might be in your wellness toolbox, just so that you can stay healthy and you can stay well, and we can have a great 2022 and moving forward.
Yeah,
a little bit of exercise, a little bit of meditation, a little bit of artwork, a little music. Makes a world of difference.
That's great. Sarah, any last thoughts?
No, well said, Matt. I think that's a big public message that our office often gives. We give a lot of presentations about the work that we're doing, and we always seem to tie in what we usually talk a lot about is SAMHSA's 8 dimensions of wellness. So if you're not familiar with those, I can put them in the chat and keep the momentum going and drop another link.
Yeah, that's the best. That's the best really framework to go from.
Right. When you're taking
I love when our chat is so active. It really makes my day. Like, I love this interaction with the attendees. That's great. Thank you for keeping it up, Sarah.
Yeah, of course. And the folks who did write their email addresses in, I have written them down so I can make sure that you're added to our listserv. I know a few people privately messaged me, so we can make sure that you're added as well. But then otherwise what Matt said, I'm completely echoing, and I encourage anyone to reach out to the Project Hope link that I put in there. That's really for anyone. It's anonymous, it's wonderful, and it's really been a great resource that we've encouraged anyone to utilize and to share, as we all need extra support right now as we're going into yet the second year of a really tough time. So
yeah, and Project Hope is at different locations, right? There are many organizations that have Project Hope as part of their programs, correct?
Yeah, and then they have an emotional support helpline. That's originally what it was called when COVID first occurred back in 2020, and they've sort of rebranded to be the Project Hope, but there is a hotline component to it, a helpline, I should say, where you're actually able to call in anonymously. So although it's scattered, there is that universal line that you can call and receive emotional support.
That's great. Do we have an 800 number for that you also know off your head?
Yeah, that should be
we have
right
the number for that. There's the main number,
Yeah, and that should be right on that website, but I can.
That's great. Okay, so I usually don't leave any homework out of the community chats, but I feel that today we need to leave homework to all of our attendees, and hopefully to people who will watch the recording at a later time. So first one is wellness, right? Self-care. Second is the bias test that I'm definitely doing after this, and the listserv. People really want to join this listserv and be aware of all these terrific programs that we have and we didn't know about. Well, Matt, Sarah, thank you so much for being with us. This has been great. I'm already reading here. This was wonderful information. People were happy to join. I honestly want to have you again, when you
Yeah,
have
anytime,
programs.
anytime.
Please reach out, this is a great way to get out to the community, let them know what we're doing, what you guys are doing, and let us be part of it, because it's great what you guys do. And to all of our attendees, thank you so much for making time for us, for learning about diversity and inclusion, and please do your homework, and I'll see you next week in our next community chat.
Sandra, is there any way the chat can be sent to us? Do you save that?
I will send you the link. Absolutely.
Chat,
Either tomorrow, Friday, that's when I send, when I finish putting up in YouTube and all of that. So as soon as the link is ready, I will definitely send it to Sarah. I'm not sure if I have, I'll get it from the chat, your email. So both of you will be receiving the link, as all of our attendees will be receiving the link as well. That way, if you can share this information with other people who you think might benefit from their information, please go ahead. The more that know about this, the merrier. And Margarita wants to know how many participants are on the chat. So today we had about over 20 people, but many more are going to receive the link and all of that. So right now we have about 2,000 people in our listserv who will be receiving the link. So that's great. Thank you again, and I'll see you next week.
Thank you.
Thank you.
Take care.